Okay, good afternoon. After a long break of 10 minutes and 35 seconds from our last meeting, we're going to call to order the Board of Health meeting on Tuesday, September the 7th, 2021 at 1:34 wall time. Please silence your phones. I don't think I had mine go back. And it is being recorded on Zoom and YouTube, and that's it, I believe. So with that, let's do the pledge and let's see if Dr. Brown can lead it today.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you, Dr. Brown. Okay, roll call, Gina.
Chairman Bill Candace.
Here.
Vice Chairman Tom Flowers.
Present.
Commissioner Kevin Day.
Here.
Attorney Clint Smith.
Present.
Tina Jones, BOCC admin.
That would be board member Kevin Day,
Oh, board member. Okay, sorry.
What was he?
commissioner.
Oh, that's right. No, we're in a different hat.
I didn't change that.
Or social service.
Oh, yeah.
It's not social service. All right, audience introduction. Let's start over here in the corner again.
Daily Day Wetmore,
Okay, and in the back of the room,
Reggie Foster, PIO.
I think that's it. And online, have we got anybody?
We have James Gilbert.
Okay, all right, so for those that call in or have speak up, we'll introduce them at that point. It looks like we only have one out there right now. It's Jim Gilbert. All right, the amendments to the agenda. Kevin?
No, sir.
Tom?
None.
None from me. I'm excited to hear some of the new terms here. I know Dr. Brown will fill us in. Approval of the minutes, August the 3rd. And I didn't get to see them because of computer problems, but I'll take your word for it. You get a sync up.
I did, yeah, I've got them in front of me. I would move to accept the minutes from August 3rd Board of Health meeting.
Get to see them.
Second.
Been moved and seconded to accept the minutes of the Board of Health meeting on August the 3rd. Any discussion? Any issues?
Well done, thank you, ma'am.
All right, thank you. So any other discussion? Yeah. I think we need any. All in favor of accepting the minutes as presented for August the 3rd, say aye. Tom?
All right,
Kevin?
Aye.
Kanda, aye. Okay, reports. Anything, Tom?
No.
Nothing here, sir. No.
Neither do I. Okay. And just from a report point of view that you're not going to get into during the 3 things below for us, Dr. Brown, COVID status, anything that we're not going to discuss in the metrics discussion.
I don't think so.
Any health issues or other items, sanitary, whatever.
Jackie's not reported anything to me except what I had already dealt with trash and so on. More than the last big building washer. It took some people's property down across other people's property and left its calling card.
Yeah, and
Those things have been dealt with.
and I know Clint brought us a report on the current status of enforcing the problem we had in the past with one of the sanitation issues. That's good. All right, none there. Any unfinished business? Tom?
no, sir.
Yeah,
No.
I think we're good here from my point of view. Okay. New business. Let's take a look at the metrics today and the issues that we've got there. Dr. Brown, over to you.
We dropped from 8 over the weekend down to 5 just because after 7 days, people go off the list, so to speak. Doesn't mean they're healthy and wealthy and wise, but it does mean that they're past that 7 day, and all of them -1 have dropped their symptoms. All of these are symptomatic. And the the comments of some of the physicians across the US have been reports that are not substantiated by CDC, but the studies that they have done have indicated that the people who are actually able to share the virus with other people, actively communicating virus to get people sick. Really, if the person is asymptomatic, their comments were interesting to me in that they said we have not found that statistically they have really affected transmission of the virus. So there's so much going on right now in history and the news and the reports that it's very confusing for the public. And it's a challenge to try to make policy based upon the scientific data that's been brought forth.
So given that and the fact that we have reduced a couple and we've got some on, and we do know that there was an issue at the school.
Yes.
That's in their hands and have been taking your advice.
Yes, sir.
And from what I understand, they closed the school for a short time until everybody was either tested or what me want to bring us all up to date publicly.
Right. Yes, and we have a staff member and several students. But after the 3 days of this very short week, we should have a better feel for whether other students themselves have been infected and are actually felt. The students that have tested positive have all been symptomatic and quite symptomatic. So this Delta variant seems to be affecting more of our young people now by far than the original variant.
So we know that was a variant thing
Yeah, they are different. Different
when they tested that, but we don't know that these specific people were infected with a variant yet.
Yeah, they were, yes, because now all of the positives are then tested
Okay.
to see which variant it is. So these are done.
So that data has come back to you.
Yeah, that data has come back.
All right. That's new to me. Got a question in the
I
back.
have a question, I want to clarify. Did we, the public health agency, issue a directive to the school to shut it down and quarantine?
No, we did not. I did not issue a directive. We met as part of the administrative staff, the school nurse and myself on Sunday. And because there were no other options essentially for protecting students, because masking is not acceptable to some of the parents and distancing and so on, there's such a backlash against all the damage that was done. We had no options except to say, well, to protect the students, we have 3 days that we will do. We have
We who?
we, as far as the
Your recommendation was
Administration.
to quarantine the people that were positive.
right, my recommendation, and to mask for 3 days.
Okay, for those people.
Yeah.
Okay.
To mask the whole population or to mask the kids?
Well,
or some
I said
kind?
that I would assist them in masking the whole population of the school, so that if anybody was not previously diagnosed, that then everybody else would at least be safe.
If they asked,
Yeah,
but they hadn't made a decision. I just want to get it clear.
okay,
They hadn't made a decision yet. They got the data from you, the 3 that tested positive, and you recommended they quarantine.
Right.
And then they were concerned about other people that were not symptomatic
yet.
yet. And so that was their discussion.
Yes, sir.
And they who, the
The
administration of the school.
administration made a decision.
Okay. All right, so
So I just want to make sure I understand that everything that was considered and the health and safety of those students, because the message we got was that it was directed from the public health agency. And that was done for the safety of the students. And the American Academy of Pediatrics said just last week that serious illness and hospitalization among children 0 to 18 is very uncommon. And in our high school, we have over 50%, give or take, 50%, give or take a little bit, of our kids who are on free and reduced lunches mostly free lunches. And so these kids are now without these safety features. Getting a meal, were all of those things discussed and considered?
Yes, but the major items that were considered were the number of the students themselves who then became infected with the virus after being introduced at school.
Maybe, this just brought up a question in my mind. Did they consider people that have already been, kids vaccinated already? Were there any, and if they?
Virtually none, because we don't have the Pfizer, which allows them
That's
to
what
go
I-
to 12.
So, and how do we know how many have been infected in the past of that population that would have natural immunities or?
We had in March, we had, I believe, 5.
Okay, so based on that, then the school administration, I don't know who was there, elected to, rather than mask anybody up, because that was an option.
Yeah, it was not
To take-
presented as a viable
So
option.
what was the outcome? Then they decided to close the school for how long, until when, and what are the criteria?
Okay, 3 days through this, in other words, through this week, Tuesday, Wednesday, and Thursday.
Okay.
The 3 days they would normally be in school, and then to reassess and see if there are any new, if there's more, if it was being contained, if it looked
Okay.
like it was going to die down and turn out to be.
So they're gonna look at it day by day with,
Yes, sir.
with you, and then decide
Yes,
based
sir.
on the data that might come to light that might be different. I can't imagine anything being more different. It's still gonna be their choice to do what they gotta
Yes,
do.
sir.
So that's good. And right now you saw a decrease.
Yes.
Okay.
And we had one new over the long weekend, but all of those were within that particular set of individuals.
They were already
who had the
quarantined.
contact.
Okay. Any other questions for him?
No, I just, yeah, I
Okay,
don't know.
Kevin's got it.
So throughout this in-person closure, have they went online or did they just close?
They are already set up and they did, from what they told me, they're going to be going online. So to miss lessons.
So that would be today and maybe tomorrow, next day. Speak up.
That if we did not issue a directive, and that's the message that's being put out, that needs to be clarified
Yeah, I don't know. who
and it needs to be
did that.
corrected.
So who said that?
It was in the call out message. It's the message that came from the school.
Okay. Yeah, that was their decision.
Yep.
Okay,
Okay, do you want me to
yeah,
continue?
keep going.
Okay, so we have currently under Cedars, 5.2% positivity within the last 7 days, 4.9 in the last 2 weeks. The number of PCRs, which are the tests that are actually more accurate, being shown to be more accurate, we have currently up through this morning, they've done 4,044 total tests, 262 current or total cases, excuse me, and we have 1 hospitalization out of the number 5 that I had given to you for positives.
Mhm.
None of those, the hospitalization was not a child, it was not a student.
Okay,
So these positives, you're showing the 5 positives, that is countywide.
Countywide, yes, sir.
And how many of those are individuals related to the school?
4.
And hospitalization is the number
Yes,
5.
one of those 5, yes. It's the
Okay.
5th.
good. And so the actual total now is 3, which you just reported.
Yeah, 4 from the school,
Yes.
3 children.
No, I got that.
Okay. We also have, by the statistics program report this morning, We have 8 total COVID deaths or due to COVID deaths since last year, the whole spans.
In Custer County.
In Custer, these are Custer County residents, okay? We had 2 more occur during the year, as I had stated before, who were not residents, but who actually passed away in Custer County. So it's a, if you wanted to add all those together, that would be 10. But 8 currently. Cedars is still reporting 6 residents, but there are, by the Vital Statistics program, a total of 8.
It's just a little confusing the way it's presented. You got a legend. Number 1 is total deaths. Number 2 is deaths due to COVID. Number 3 is total deaths, all causes. And then 4 is deaths due to COVID. Those seem to be 2 and 4 seem to be the same. So
Right up above it, sir, there is Custer County residents,
Mhm.
categories 1 and 2.
Ah,
Custer County occurrences, categories 3 and 4,
okay, so Custer County occurrences.
are non-residents who were in Custer County at the time they passed.
Oh, got it. So that brings the total in residents down to whatever it is.
8.
All right.
Yeah, it might have helped had you put Custer County non-resident occurrences for categories 3 and 4.
Little easier.
Kind of had to read between the lines if that's what you meant. Was
Yeah,
We had spoken of this before, so I didn't do that. I should have done it.
And then there was confusion about that COVID was present, but not necessarily the cause of death.
Right.
Is that included in the 8?
Being reported to us right now.
Okay. All right, go ahead.
Any more questions, gentlemen, on that? Kind of things.
I don't think so.
Go ahead.
Vaccination status in August. First vaccinations, we did 27 additional. Total second vaccinations, another 6. Once again, these are just in August. And the third were immunocompromised individuals, 21. Questions there at all? We started in August, in other words, the first of the third vaccination, quote unquote booster. So in July, I had reported a total of 1,836. In August, another 27 first doses, for a total of 1,863. Second doses, 1,773 in July, cumulative again, another 6. So now holding a total cumulative number of 1,779, and for third doses, 21. So our cumulative total in Custer County, given by our public health agency, 3,609 plus 31, which is 3,640. We are scheduled currently in September to have first, second, and third doses offered each time we open up another clinic. So nobody is being left out. And we have 2 clinics scheduled at this point. It's the 10th and the 17th of September. But the site here will no longer be in the Custer County Public Health Agency, but will be specifically located in the school gymnasium.
Yeah, you mentioned. That's good.
Why is that?
Because we are scheduling more people. We want to keep it organized so no mistakes are made. But it starts to bog down after you get up to 40 people scheduled in a day out of, drive-throughs. Things start to get a little.
It takes a little more time.
Little time through. Yes.
Tina.
Okay, do we only have, which school gymnasium? Because I didn't go up there, I don't know, is it?
East,
high
west
school,
gym.
I believe it's the East Gym.
Thank you.
All the people who are scheduled, we are completely full for next Friday, for the 10th. The clinic scheduled on the 10th is completely full at this time. So we're almost full for the 17th, and we'll continue scheduling more as we need to. Questions?
Any issue people asking about boosters and what it means, if there's any?
Yeah, we're answering those multiple times a day. Or everybody who phones in, lots of people are phoning in, asking for the third vaccination for the booster. But all that we are allowed to give at this time is a booster, so to speak, for those who are immunocompromised.
Is there really some data that supports different vaccination to be the booster for the other one?
It just makes it more recommended, more of a safety issue. So
If it's the same vaccination.
it is the same
Vaccine, I should
vaccination,
say.
same vaccine, exactly, that is being given for the third. But from some of the large studies that have been done, Israel reported about 6 months was the really most beneficial, most effective date after, or lapse of time after the second.
And is there data supporting the booster at all? I heard, and this is just trying to clear up speculation and rumors.
The breakthrough, the actual infection again, where people getting sick a second time in spite of the vaccination, occurred in the Israel study more often after 6 months, which is why they suggested we come back in 6 months.
But it was significant enough to require this work.
It was highly recommended for people who are at highly at risk.
Okay,
People who are on heavy dose steroids, for kidney transplant or liver transplant or something, or being treated for cancer. Anything that cuts down the body's autoimmune system's ability to respond and protect.
Okay.
Questions, other questions?
No.
Okay, your
I
second.
think Kevin's got a question.
I'm sorry.
This might be just to clarify, because and forgive me if I misstate this. Because there are, I don't know, reports out there that say that there is a possibility that the vaccines are actually providing, because of their nature, I guess, or something, a conduit for the virus to come back in. And for the reinfection, is that a correct statement, or is that not a correct statement?
There are reports of all sorts of things.
Mhm.
And anytime you're dealing with millions of vaccinations, whether they have the vaccinations or not, but there are some that you're going to have responses because you never know how the body is going to respond to that vaccine. But they are, when you look at the statistics, and we'll go through some of these here in a little while, statistically, you are much less likely to come back with getting sick again or getting sick the first time if you've had the vaccine. Are there specific reports of people with serious responses in the body? Yes, absolutely. It's always been.
Yeah, and I think a lot of this, you referenced Israel, they're starting their 4th rounds now. But they also, out of that same report came, they have one of the highest incident rates right now worldwide, and they're the most vaccinated country. So that's I think that's where that report came from. And so I know that people know about that. I wanted to ask about it and see.
Yeah, that's why my comment.
Yeah.
If you just choose your data,
Yeah.
you can come up with any conclusion if you want. It doesn't mean you're wrong at all.
So is the body reacting like it's been reinfected to the booster?
Effectively, yes.
And so they
Even
get just
though
a
it's-
sick feeling as they.
Yeah, it's not a live virus or anything like
I get
that,
it, I understand.
but
But they reacted like it was and feel pretty miserable.
they get sick.
Okay, so that's why you don't want to do it if you have other issues.
Yes, sir.
Okay,
Try to be extra careful, or at least careful enough to kind of balance out the
Okay,
good, the bad, and the ugly.
all right, keep on going.
Okay, the next in your stack, whatever, is just a comment from the original. Now, these are front and back, so just looking to front, you won't see everything. This one doesn't have the back, but there are some that do. This is the budget template. Tom had asked several times about EPR, and I wanted to make sure that we touched on some of this, also to keep you kind of updated on changes that we are applying for various grants. So in the very major ELC grant for enhancing detection, you'll see the little yellow box up there. These are the monies that are being collected or have been okayed, given clearance, so to speak, by their epidemiologists and the people managing the grants. We are winding down as far as the immunization, the amount of monies being used by the vaccination grants, because we're not doing as many people, so we're not having to pay those. So we're shifting over to the enhancement to the follow-up care as best we can to do a really thorough job in investigation and tracking and tracing.
Mhm.
That one does have a flip side to it, gentlemen. So it just gives you some of the terms of receiving these monies that we're reporting on. For instance, we're not charging anything for travel costs. You know, and we're gonna probably have to do some running over the mountain to pick up vaccines of various types so that we can have all three vaccines being available to our public here. So instead of people having to drive over the mountain, so to speak, to receive Pfizer, for instance, for their child, if they want that, we should be able to now provide it for them. And J&J. We've not done that yet, but I'm just telling you that's what the plans are. That's going to happen. As recently as Friday.
Mhm.
Bruce or anything else?
In regards to that, going over the mountain and picking up different vaccines. Has the storage requirements changed enough
Yes, they
that
have.
our facilities are adequate?
They have, and the other thing that is now really nice for us is that the Pueblo EPR, but also just in general, the public health there has agreed to give us just literally the number that we need, because they have hundreds and hundreds and hundreds. They literally have thousands of the vaccines. So when we say we need 54, they can give us specifically 54, so we're not wasting vaccine. And it is now available for storage for weeks, not days. And so we can hold it in our, not a minus 70-degree freezer, but in our freezer and then in our refrigerators for a period of time that will allow us to use up hours and schedule our clinics and many fewer people. Anyway, that's kind of the basis for which I said now we finally have an option that we didn't have.
Thank you.
Okay.
So in the Pfizer grants, the very next page is just a single page here. I'll read this to you on July 23rd, the US FDA fully licensed Pfizer for 16 and over. But they are also through the emergency use, which is what almost everything has been. has made it available to children, to young people 12 to 15. So they changed the name, but it's still the same. About 1/3 eligible Canadians or Canadians, Coloradans still are not fully vaccinated. And so we can say, yes, we do have statistically a better resistance, but not as much as if they had both vaccinations, for instance, in Moderna or Pfizer, they've only had one.
But we don't know how many of them actually had COVID and have natural
That's
immunity
right.
of that first. So that's not a
Yeah,
very.
that is just for vaccinations, okay? That is not including, in other words, what their numbers do not include are all those who have had COVID, but some have had COVID now a couple times.
Yeah.
So just because you've had it, when we have these new variations, we're gonna have it again, we have some more coming up.
Sure.
Okay, the next is an informational packet for all of you to be able to answer questions. It's essentially what the CDC has put out, saying, okay, this is why we are advocating a booster. So they're looking at preventing severe illness, hospitalization, and perhaps death. Yeah. That is the claim. So because we are constantly seeing the development of new variants, it is not something we can just kind of sit and say, well, I'm vaccinated or I've had the virus, so therefore I don't have to do anything, don't have to worry, don't have to protect myself. So as Dr. Walensky said, the third dose is needed to boost effectiveness of the vaccines, mainly due to the highly contagious variants.
Oh, I printed it out this morning.
If you look down to the immunocompromised individuals, there's a third dose of either the Pfizer or the Moderna 28 days after the second, not before then, because you have to let the body have time to start developing its reaction response.
Okay.
So the third dose for the immunocompromised is part of the initial protocol, just to keep them fully vaccinated. Now, there's been a lot of press out saying, you're not going to be classified as being fully vaccinated unless you have all three doses, but that is certainly not the case at this time. So in general, in the United States, they're saying, all right, 8 months after you received your second dose of Pfizer or Moderna, then you're eligible. But we have not had a vaccine made available to us to even give for the people. So we're just literally collecting names right now of people who are interested. It is the same vaccine as we talked about before. Any particular questions, gentlemen?
Is it your opinion that this variant thing has not been a significant impact on our county?
I would say that because so many people have been vaccinated and or had the COVID virus infect them, that the major portion, as we will see when we look at some of the charts down here, is that almost all of the people infected now are no longer being infected by the original dose that they developed their immunity to, but the variant, the Delta, is affecting us. If it were not for the Delta, in my opinion, and from what I've seen from all the studies, if it were not for the Delta, we most likely would be pretty free and clear.
And do you have a number of Delta variant confirmed cases in our county?
Yes, essentially all of our cases.
Most recent.
Confirmed recently. We're not talking about 5 months ago, but we're talking about in the last several months, June, July, August.
So from that point of view, you're right. If that's Delta or variant related, it's not like the original one where it was just taken off like gangbusters, because we are protected to some degree, apparently.
If you want to look over, this is the LPHA Director's epidemiological update. That's your kind of your last, it's the thickest of the pages that I gave you. You can look on, go through the hospitalizations. Let's before we go to complete that thought, if you look currently hospitalized confirmed COVID-19 patients with pediatric age groups, there is a slight rise there for sure. It would be 1, 2, 3, 4, 5, 6. It's the 6th age staring at you, not counting front and back. You should have kind of a pink rose line across the top. The 793 adults 18 plus. So there's been a slight increase in hospitalizations for that age group. But if you notice down there at the bottom, there were 9 0 to 11-year-olds and 6 12 to 17-year-olds. So there statistically, you've not seen a big change. Okay, continue. I wanted to show you the chart that gives you the percentage. Still looking. Here it is. It's on the back of the first page. I'm sorry. Skipped over. COVID-19 grants, public health concern. And this is up through the 15th of August. So if you look at the very top, you'll see the AY1 and the AY2 delta.
Back on which page?
The back of the first page.
This one here?
Yeah.
Okay.
It starts off
I'm right, I got it.
here. And
Just wanted to make sure because it didn't jive with what you're saying. So you're saying the AV1 delta starts, those colors there is where you're at.
yes, the pinkish.
Got it.
Okay. If you notice, it's almost 100%.
Yeah.
99.2. I mean, effectively, it's 100%. So dealing with the Delta variants. And it has been for the last 3-4 months now.
So that is what, just Colorado?
Yes, this is Colorado.
And how's it look in our surrounding counties?
It's essentially the same. We are paralleling where they are. So by now, since everything changes so much from day to day and changes from week to week, by now things have changed some, but it is still, that is the variant of choice, so to speak, where we're seeing even in our hospitals, the kids are showing more response to that one than they did before, even though when I'm talking about within the last month, even though the adults, it's very, very similar to what was there before.
Okay.
Our deaths are basically most of them between 60 and 79. We have a few above that age, but there you're dealing with other concerns also. Other questions, gentlemen? The hospitalization status on that pink line page that was staring back at you, right across on the back of the previous page, hospitalizations over 100,000. Colorado is still actually doing fairly well compared to the rest of the US. That just takes a glance. We don't have to labor that at all. But the pediatric age groups have come up some, but it's still, we're dealing with very, very small numbers. We had a little blip in August as far as hospitalizations also. And that will continue, I expect, as long as we have people sick in that age group. The number of deaths has started to drop back down again, however, and it has not been up. I mean, it has not statistically been up since a little rise at the end of May. So we've not gone high, we've not gone low, we're just kind of hovering around a plateau. For the kids, for the children, the pediatric population, respiratory infections, the RSV, they had a big surge here in the summer, and we are hoping that that will calm quickly also. We are doing all of the various vaccinations from a flu to whatever as a continuing basis. By the way, for the hospitals, we do have sufficient hospital beds already designated to handle the COVID virus patients in our 3 surrounding counties, to the north, to the northeast, and to the east.
Yeah, I know that was a rumor going around. They're all full.
Yeah, they're not.
And so the designated COVID ones are not full. And then on top of that, the other rooms could be made available.
That's right.
Because there's a lot of elective surgeries and other things.
That's right. And that's data, that's the results as recently as Friday.
Okay, good.
Okay, other questions, gentlemen? There's so much information there. I'm hesitant to.
I think you did a good job of getting us to the important stuff.
I have a question. Is there a way, Colorado has the mobile vaccination buses. Since we do not have a vaccine that is authorized for our student population, is there a way we can request one of those mobile buses or something so that our students have the opportunity to be vaccinated if they want without having the burden of the parents? So many parents work, they don't have the ability to take them down the hill.
When they are available.
And that's what I was commenting on here just a bit ago. And that we now have the availability for the first time as of Friday to call in and say, okay, we have a clinic where it's scheduled. We need 17 doses for kids, 12 up.
Okay.
We now have the ability to get a hold of Pfizer
Okay,
for the
so
first time.
I'm sorry, I
Yes.
missed that comment.
Yes, well, I was talking the other way.
Which is a little different, I think, than her actual question.
Okay.
Oh,
Yes.
Her question would be, do we have the ability to bring in one of the mobile buses?
We do, sir. Our history of people showing up for those has been significantly weak. So that's why I haven't scheduled somebody to come in, only to not have people show up.
Because our numbers are so small.
So small.
So then do we need to do some kind of education about the fact that we can now get that vaccine and it's available for kids and have parents register? Because that's not information that I've been.
Right, you have not received it because
Right.
I haven't given it to you yet
Right.
today because I was going to this place for some reason. Yeah, that is going to be through you, of course, advertised so that people now know that there is availability here for the first time for both J&J and particularly for Pfizer, so that the young people have an
I
opportunity.
didn't think J&J was authorized for kids. Did that change?
It's not at this time, but we have J&J for the adults and Pfizer
got
for the
it.
kids. So we have the two big ones now available to us that we did not have before.
And what are the kids' ages?
It's 12 through 16. It's still not, there are exceptions that are made, but it's still not really recommended because there haven't been good studies done, really big, good studies done. So the FDA has not come out and said, 3 through 11, it's available to you now, except for particular situations.
Okay. All right, let's move on.
Okay, I think that is probably, I included for your information, the governor's new order. And I think the big things, the big items out of his order center around on page 3. That he is requiring when you go into a surgical center, when you go into a hospital, saying are required that you wear masks. So doctors' offices and others of care medical structures. That's at the top of page 3. And then there are the exceptions for the people who do not tolerate it, 11 years and younger. To enter for business or receive services when they have to remove the mask. It's not going to violate anybody's order for them to take it off. Or the speaker in an auditorium. So for work, and that goes on into the next pages. Particularly the face coverings when you're dealing with government facilities is number 3 there at the top of page 4. So strongly encouraged that at least he is not saying absolute mandate. The schools are still to be responding, to be supporting, and particularly in their reports to the state. So every child can be followed up on, so to speak. And under county restrictions, that's letter E. CPHE, that's the Colorado disease. May require counties whose resident hospitalizations threaten to exceed. Since we don't have any resident hospitalizations, it's pretty hard for anybody to mandate much there. State contract workers, once again, because we are not dealing with a lot of federal facilities here, it does not affect us a lot. For the individual specific exceptions. Other questions, gentlemen? There's just an awful lot of information there. At least just there for your review.
I'm good. Any questions on the order, guys? Tom?
No.
Kevin? No, sir. Reggie, you got the copy of this? If there's anything relevant to get out. Looks good from our point of view. All right, let's get on to the next item, which would be consideration of using VMS boards. And we need to understand what VMS boards mean first.
Those are the signs that we put up on the traffic warnings and this type of thing. For instance, if we had one of these gas trucks or
No, I gotta get that.
rupture.
Right. So the issue is what then?
Basically,
I don't think he brought that
I
up.
didn't bring it up.
That brought that one up.
Yeah,
Then Tina, tell us.
So basically, it's been a while since the board has been taken down, probably right before the fair and all that. They were moved and then they weren't put back up. My thought is COVID still isn't gone completely. And I think it might be, my suggestion that maybe we bring those boards out and tell people if you're sick, stay home, maybe put messages on there about, the vaccines are now available, in Custer County for the children from this age to this age.
Yeah, I think that's
Contact, I mean, those are things that, just to let people know, hey, still social, what have you, but I mean, I think we still need to get some messages out there, just to let people know, hey, it's still not gone, still use caution.
Totally in agreement.
So it kind of brings up a question in my mind, is eventually we're gonna get steady state here and we're always gonna have COVID. Period.
Right.
Because it exists, that's it. Somewhere we're gonna have to decide, people have gotta take responsibility. Do the normal thing you did with colds before and flus and other things. Any discussion in your meetings yet on what and if that might happen? Because I see the variants are even playing out right now. Not that they're gonna go away, but they're.
Yeah, we have not overwhelmed our hospitals. That was always the national concern. We overwhelm hospitals and let people die. We have people die all the time anyway. Is it exacerbated by this particular virus? Yes, as well as others. So I certainly agree with messaging. And I will.
Right, and the reason I brought it up is we have to be careful because we don't want to turn it into something that people will ignore.
And that's exactly.
Because that's sort of, we're in a steady state in their mind right now. And we want it to be relevant. So I think good things like, hey, you got the boosters coming, here's what we can do. The kids have now been authorized, those kinds of things. So I wouldn't, I know we have a process to put those messages on there and vet them. But don't go hog wild and get us in trouble. Where we can't, we want to be relevant.
We have had as many people as we can scheduling for vaccination clinics right now.
That's really pretty neat that that's happened without a lot of hoopla.
It's coming in. People are paying attention, and I am impressed again with the amount of personal responsibility that people, when they do get sick, are exercising before they even admit to anybody.
Well, I think the message came home that you're accountable. Get with it. You can't you don't wait for somebody else to tell you, which has been our message since the day we decided to take control of our own destiny. So that's good. Keep it up.
I'm very impressed.
I think speaking to Tina's point, they have been down a while. I don't think it would, I think it would be a good time to stick them back up for a little bit. We don't want it to get old and stale. I agree. And so we don't want the same message up there for 4 weeks in a row. We want,
surprise.
we want to address what's relevant at the time. And so just like now, we had somebody sick going to school and so now we're shut down for 3 days.
That'd be a good message.
So maybe tell them if you're sick, stay home. If you're, tell them that the vaccines are now available. So we've got a couple of different messages we could throw out there.
Yeah, I guess a good example would have been when the school decided, when they had a little bit of, would have been nice to have message boards out because a lot of people went to the football game and it was dark. Wouldn't have hurt.
The other thing,
Get the word
I
out.
know Adrian has struggled some because we have to wait because those are in state highways. So we have to have permission from them.
But we do. We have a role. We have a permit.
They can go, so we can get them put out.
And we can put them anywhere in the county.
But you mentioned putting them in different places.
Yeah.
So along the state highways.
Yeah, there's only 3 or 4 of those, but there are other places that even the state, we can see from the state highway, like at the rodeo grounds.
No, I was just, back with the school issue, the fact that, and not that I have kids, but it might have been helpful for people to, if not everybody knows that, they're doing online schooling today, tomorrow.
Sure. And that means we gotta work with the school to get what's relevant from their point of view, because we're not gonna know what's going on over there unless Reggie, who is really the go-between.
I believe that they did send out messages.
Sent them home on flyers, but that didn't go to the community.
I see.
I can program and I can get them down. So,
Yeah. It was.
Do that this afternoon.
Okay. Next item, is there any other discussion on that one? Are we good?
Who's gonna make that happen?
Yeah, Reggie said she was gonna grab it along with,
stay in.
you're gonna work with Cliff and get the
Right,
messages.
well, once they get out, I'll get them programmed.
Then we can figure out how to work, keeping them current relatively, between whatever process you all want to set up, so that we don't get, like Kevin said, stale.
Everybody ignores it.
I think Adrian's
Yeah,
out of
Adrian.
town, right?
Yeah, he's gone for the rest of this week.
So
But I can work with.
Yeah.
With Reggie.
Good.
That way he can see him when he comes back to town.
Yeah. What you doing with my boards?
So you weren't missed after all.
Okay, let's look at that MOU for substance abuse prevention block grant now.
Basically, we have a gentleman, Patrick Fiore. He's been working with us for a long time. He's very, very good at what he does. And I am, because of the number of suicides and the number of people who have literally just kind of withdrawn into their cocoon, and so they're no longer functioning as they used to. To me, it is a very serious, just from a personal note. A young man that essentially grew up in my home. His son was a summa cum laude, baseball scholarship, returned home. Within 2 months, he committed suicide. Just, so it's not something that people like to discuss. People will admit to having heart disease, but they won't admit to having some of the other problems that deal with mental health. So it's a tough slug. It's a tough sale to try to get people to come in, but to treat them in a positive manner, supportive manner, and consistently until they are able to get past the downer where they were. Attended on Thursday. Anyway, last week, one of our senators was helping to initiate or to recognize the behavioral health center up in Chaffee County that is now being constructed right next to their hospital and also covers for our county. So it's kind of a center hub in drawing in. They will have 6 inpatient beds and they will have several clinics that will be ongoing to get people back on their feet
Okay.
when they've had problems.
Okay, so for the record, there's a proposal to have the school district and the Board of Health to work together on a substance abuse prevention block grant. How much is it? And are you equipped, if you do get the grant, is it going to mean you have to hire some counselors? You're going to take some training in psychological effects of marijuana or whatever? What's it mean?
The main provider of care in this county and in our surrounding counties is Sol Vista.
Mhm.
They're quite well accepted in the behavioral health world because they handle Pueblo, Chaffee, on and on through here. And because of that, I do not see us having to hire, but we can be supportive. And that's essentially what the memorandum of understanding, in this case, memorandum of agreement, is support, so we can use them as a referral.
So who handles the money for them?
Not us.
School.
Just the school?
We just discuss it. And that goes through Mr.
So your relationship then would be what? Just to be a co-sponsor and to refer people?
Support, yes, support the referrals.
If I may, I'm looking at the top of page 2 on this, number 2. Yes, it says the Board of Health will hire a community-based coordinator
We have, that's what I mentioned, Patrick.
Okay,
Yeah, that's why I asked who you,
okay.
you're bringing somebody
Yeah,
on.
I'm sorry. He has already been on and we'll be continuing him, but this will be part of the support, financial support.
Okay,
But it's not a brand new program, is all I'm saying.
Okay.
It's already there. We are just signing a memorandum so that gives him probably more clearance, more freedom.
Is it halftime of his time or what is it?
Yeah, he's part-time with us, but he operates under several different grants.
Okay,
But I'm totally supporting the program.
okay, so this particular MOU has already been signed by superintendent. Okay, well, I move that we accept the MOU and become a partner in this grant on substance abuse prevention with Custer County School.
Second.
It's been moved and seconded to become and sign this MOU as a partner with the school. Any other discussion publicly, anything online? Okay, questions in here? Okay, all in favor, say aye. Kevin?
Aye.
Tom?
Aye.
Kanda? Aye. All right.
Any other questions, gentlemen, from any of you about any of these things we've kind of touched on today?
Good.
I'm good. Thanks for a pretty thorough report there, Dr. Brand.
There's
Appreciate
just so much information. I don't know what detail to go into unless you guys ask specific questions.
I'm going to assume, shouldn't do that. I'm going to ask. Do you see basically that we are kind of following the norm? I think I know in the neighboring, one of our neighboring counties, they've had an uptick in their schools. And I think we're kind of following the same thing because now we're putting all these people together that were not grouped together. And that's why we see the incidents in the schools at this particular point.
This was a little different than the cohorting that we've been dealing with before. This had to do with one particular individual attending an event and unknowingly coming back ill. And
Should happen to
so-
any of us anyway.
Exactly. I mean, it is not his fault. It's not students' fault. It's not a teacher's fault. Literally, these are things you expect when you have that is really critical. So I don't see a big jump. That's what I'm saying. I don't see a very large, mountain that's insurmountable here. But that's why the school, and I am totally in concurrence with them trying to do everything they possibly can with the limits that they are given to stop that from becoming a big issue in the school.
And I think it just is a fact. I mean, it just happened. Now we've entered the way to put the people. So it's a different group of people.
Yeah.
Whereas before, there's a concern at different times for different groups of people that are coming together. And so that's why we saw where we did.
Yeah. And I really am glad that we do need to keep on top of the rumors because nobody wants to see the school shut down. Any school, anywhere. We've got to get these kids out of their masks, how to speak and relate to people, especially the little kids.
Yes. If you notice the children in grade school, primary school, not being affected.
Okay, that concludes the business. Any public comment in here?
I have some.
Okay, just a second, we'll get to you, Jim.
I have some.
I got you. Can you
Okay.
hear us? Can you hear us? There's some noise online here. Oh, okay. All right, Jim, go ahead. I don't think anybody else has got a comment. Go ahead.
Yeah, a couple of things. One is I'd like to correct the record when Mr. Kanda stated that the county is fairly well protected with only almost 1,800 fully vaccinated people. That's well less than 50%. And that is not well protected. So let's not lose sight of that. We still need to push the vaccines into the county to try to get that number up. The second thing is that just came up is I assume that you are aware that the school is not following the CDC nor the CDPHE guidelines for protecting the students from COVID. And the last thing is a question for Dr. Brown, that since Pfizer was approved for refrigerator storage post-thaw in May, why has it taken so long to finally get access to any Pfizer vaccine? I know that you can order small lots of the vaccine from the state. There's a form for it. I sent it to you. But I don't understand why it took 4 months from the capability to store it to actually get it. That's it.
Thanks, Jim. He's answering your question.
When we began with the Pfizer, or tried to begin with the Pfizer, we were still told, in spite of all the other information that it took, and I'm sorry, but I'm pulling these numbers off the top of my head, but it was something like 550 doses. So yes, there have been very few people actually asking for the Pfizer until it opened up for the children, for the young people, for the 12 through 16 age group. There were not enough people requesting it for their kids until it opened to that status for us to even handle more than just scattered numbers. I mean, we're talking less than a handful. So the people who phoned up asking for it did not warrant bringing in even 40, for instance, doses to our county because we are not having the demand. So that's why I put off trying to bring in a bus, trying to bring in specific vaccines, because you do not want to mix and match without, because you increase your opportunities for mistakes to be made. So the vaccine providing nurses were hesitant, and I followed essentially what they had told me until such time as we had more of the vaccines, so we can separate out the clinics. We don't have enough people here to have one nurse handling all of our vaccinations for Moderna, and another one for Pfizer, and another one for J&J. That's not part of, in our small clinic, what we can handle efficiently and effectively and safely. So I hesitated to bring it in until I knew that there was going to be more and effective, safe provision of the vaccine.
All right, thanks. Any other comments? Okay, hearing none. Any motions to remove ourselves?
I'm not usually going to do it.
I did it before. I'll give you an opportunity.
I move that we adjourn.
Okay.
I've been moving second to adjourn. All in favor, say aye. Kenny?
Aye.
Tom? And aye. Thanks, everybody. Good meeting and good data. Thank you.